Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we're talking about our interview with Dr. Minal Patel, who is the CEO and founder of Abacus Insights. And it was a really great conversation. I think I say that every time because I enjoy all the people that we talk to. But I really love that Minal is a physician. And then he's also really into data. So he uses his background as a physician, and really that drives the mission of Abacus Insights, because he's been in the hospitals and the doctor's offices and seeing what happens when data doesn't get to the patient in time. And so with that background and insight, he's really able to help his team understand that this isn't just a file that they're sending. It's connecting that person and the data and making everything very real and tangible. And he's just so mission driven by this, because he shares a really great story about not having data given to patients that could help them after they experienced some devastating event like a heart attack or a stroke or something like that, and helping them with mental health. And so that's a great story that I won't share, but he does. And so he has some real life events that he shares and just makes it super real and evident that data is not just data. Data is super incredibly important, but you have to think of it that it's driving that human connection. So he's helping the health plans, him and his fellow beads at Abacus Insights are helping health plans make sense of their data and get that to the hands of consumers so that they can make better informed decisions. Apoorv, what stood out to you?
Making data personal, I think, is what you were saying, Stephanie. If there's anyone who can do it, it's Minal. He's just such a dynamic, incredible, relatable individual. It's very easy to access. You can just feel and see his passion and his insight. So it's unbelievable. And it's data could be such a dry topic, as we were talking about. It's very easy to see people thinking, well, it's just another spreadsheet or it's just another task. And he's got to be able to inspire his company and his people so that they understand that behind the data, there's millions of people that are actually counting on that data, getting into the right hands in the right way, combined with the right insights so that they can get the care that they need. So I find that this company is exactly Minal's calling. Having known him for now 20 plus years, I just think that he's the exact person for this, not only as an individual, but also with his background in consulting as well as a physician. I think he's combining the insights and bringing the insights so that they can solve the challenging problems of healthcare, which is errors in the data if you're doing it manually, latency in the data, which means data getting delayed because, again, it's a manual process, inaccuracies in the data, and then insecurities in the data. So they're addressing some very, very key data challenges. I found that really fascinating. The other thing that I found really fascinating when we were talking about innovation in healthcare is he said, innovation in healthcare is going to go at a different pace. It may not happen dramatically. It may not be a flip to switch kind of a moment. It's not about what happens in Silicon Valley. It's about actually understanding that healthcare has to do a lot of things in a certain way because of the regulations and because of the patients' lives, safety that's at stake. But nevertheless, innovation is happening. He's seeing that the new partnerships that need to be coming together in this new climate are coming together. Those kinds of partnerships create more creativity, the space for innovation, the space for opening up our thinking and opening up our bounds. So it's fascinating to hear him talk about that and understand that, yeah, maybe the disruptive moment is indeed upon us, but it isn't a particular moment, that it's a period of time that's now starting. So I found that conversation really inspiring and fascinating, and I just wish Minal and the team at Abacus all the power so that they can really go after their vision.
Absolutely. I love seeing companies like this with inspired leaders who are inspiring their teams to really go out and do good work that is making a difference in the lives of these patients every day, even though they're not directly working with the patients. And it's just such an amazing story. I loved hearing it and why he started what he did. So I hope you all stay tuned for the interview on Thursday, and we'll talk to you soon. Bye-bye.
Bye-bye.